Matt, why don't you start us off?
Okay, thanks. I'm going to start off actually with a quick PowerPoint presentation. The Maine AFL-CIO and the Central Labor Councils in Maine, as well as my union local 1837 of the IBEW, have been committed for several years to building support for single payer within the union movement. And the Maine AFL-CIO initiated a single payer internal mobilization program that we've been bringing throughout the state. The first thing we've done in most cases is holding a meeting with the local union president. I know there are probably a lot of folks at this conference and in this room who would prefer a bottoms-up approach. That's fine. Obviously, whatever works for you is what you should do. We chose to start out by working with the local union president, meeting with them to explain the single-payer system along with our mobilization program. Immediate goal of the step was to get invited to make a presentation to the union local's executive board and then to a membership meeting. In each case, the problem, what causes the problem, and the solution were explained, and many questions about single payer were hopefully answered. Educate, educate, educate. Again, the primary goal throughout the project is to build an educational apparatus within organized labor. As a result, each step requires a full single-payer presentation because we find that it takes a while for a person to get their minds wrapped around the totality of a universal single-payer program. Getting buy-in from the local union leadership. After we would meet with the local president, we would then present to the local's executive board. We'd explain a single-payer healthcare system, try to answer the questions, and explain our internal mobilization program. We would then ask to move the program into the local, to various local meetings, and if we got permission from the e-board, we'd take it to the next step. And that would be to train other people, rank and file union members, to explain single payer. Volunteers are recruited in steps 1 through 3 who are willing to do the following: come to a training meeting where we would go over how to talk about single payer, and then the new healthcare communicators would begin a pilot project at individual work sites. Okay, I know this is pretty hard to read in the back row, but getting into the workplace is obviously what we wanted to do. We'd ask the locals to try to run a pilot project where they begin to talk about single payer in the workplace. The trained healthcare communicators would engage their sisters and brothers one-on-one in a conversation about the problem with our healthcare system and the solution, that of course being single payer. Over a period of several days or weeks if necessary, they have these conversations. Along the way, of course, we would always stress that this is a long-term struggle, and if we don't enter the struggle with a well-educated membership, we'll never survive the insurance company onslaught. Obviously, we would be talking about the challenges we face at the bargaining table. People would be telling their own personal horror stories about health care. Even though most of our members have pretty good health care because they are in a union, chances are they have friends or neighbors who have fallen through the cracks. Once a member is convinced single payer is the way to go, they're asked to sign a postcard in support of health care reform, and specifically HR 676. Taking action. We would collect at least 2 cost sheets from rank and file members of union locals where we're doing targeted research, and more on those cost sheets in just a minute. We'd use these cost sheets in a presentation to the union local and or e-board in which we'd ask the local to pass a resolution calling on their national or international union and the AFL-CIO National Federation to commit to a long-term strategy to win a single-payer system. Now obviously if your state federation has not already done this, you would also want to get a resolution passed at that level. The cost sheets. these are the sheets that bring home to folks just how much money they could save under a single payer system. Pat, yeah, that's great. Yep. And this is a kind of a scrunched up version. You'll see on one side is a blank cost sheet that lists how much the individual workers pay, the percentage of payroll. Pat, you can hand out the completed one at the same time. Thanks. And by filling out this cost sheet that lists the cost, how much you pay in your deductible, your copay, dental care, the employee total, the employer total, compared to what you would pay under HR 676, you see in the end that you have much better care at a much lower price, not only to you as a worker, but to the employer under HR 676. And Pat Shore, who's handing out some blank copies of this and some completed copies, is actually one of our rank and file union folks who filled this out, and she's been kind enough to share her personal information with us for this workshop today. Pat, what did you think after you filled out?
After I filled it out, I thought I had good insurance. I have an HMO. I pay for it, but I have an HMO. And seeing how much less I would have to pay for it and have absolutely everything included was amazing. My husband actually had to have surgery. He had prostate cancer. We were stopped with a $1,000 bill from the hospital because the insurance paid everything but $1,000. Prescriptions, he has to have his prescriptions. We have a good copay. Sometimes it's not all that great copay, so we have to throw that out of pocket. And the single payer health care plan will take care of everything. Not only, you're going to worry about the operations, you're going to worry about getting your pills on time, but you don't have to worry about whether or not you can afford them. You know, even though you have insurance and your copay is for 3 months $90, it's whether or not you can afford that $90 at that point in time. Or do we go a week without it so we can eat?
So obviously Pat was convinced. Most of our members have been convinced when we've done meetings, gone through this cost sheet. What we usually get is, well, why don't we do this already? You know, people just cannot believe once they see the figures what a great idea this is. And companies like Pat works at Central Maine Power, which is Maine's largest electric utility. They just came very close to going on strike over healthcare related issues. So it's something that has been top of mind for many of our members. This is a copy of the resolution that we sent to the National AFL-CIO, calling on them to push for a single payer plan. And, you know, keeping up the momentum, even once you've explained this at a union meeting and people are, you know, impressed and very much on board with it, we find that it pays to go back again and again to continue discussing these issues. Establish a system of monthly health care updates related to single payer, disseminated in the workplace and at local union meetings to deepen education around single payer and bring new union members into the fight for a single payer system while also maintaining the momentum we established in the previous steps. And finally, the documents, the cost sheets we handed out and some other worthwhile documents can be found at this easy to remember URL, http://unionsforsinglepayer.org/other_resources/ I'll leave it up there so you can copy it down. So that's what we're doing in Maine, and in spite of the so-called federal reform, we continue to work this program. Thank you.
Thanks, Matt.